You never open your door at night. At night is when the thieves are out. At night is when the militaries are battling. But everybody was home at night because that's when the gunshots started and that's when the explosions started. One evening, I was indoors and it was late at night, and there was this bam, bam, bam at the door. And I, what's this? And I look out there. Well, the front yard is filled with soldiers, and there's a guy with his gun and he's banging it against the door of my house. And of course I think to myself, never open the door at night, right? Never open the door at night. And I walk around the perimeter of the house, and the whole house is surrounded, and the guy is still out there pounding on the door. And I think to myself, they're going to come in. There's no way I can prevent this. And so I unlatch the door, and the door creaks open, and I'm expecting the room to fill with these young guys and their guns.
In a corporate world where all employees have great leaders with no egos that create fun cultures where people can do their best work, the employees and companies thrive while doing great things for the customers, themselves, and each other.
Well, we know that rarely happens. I'm Jeff Palacio. I have been a leader for over 40 years for every t-shirt size company, from small 16 employees to extra large over 1 million. Please join me while I interview outstanding leaders that will share stories of great leadership and not so great. It will help you become a better leader while poking fun at all the crazy shit that happens in corporate America.
Hi, I'm Joe Deshawn, and welcome to the Corporate Couch with Jeff Palacio. Today's episode is brought to you by Palacio and Partners, providing turnkey podcast creation, hosting, production, promotion, and related creative resources for you and your business. Today, Jeff is interviewing Dr. Nicholas Comninellis. Dr. Comninellis is the president of INMED, the Institute for International Medicine, whose mission is to equip healthcare professionals to serve the forgotten. He has a medical degree from the University of Missouri-Kansas City Medical School, as well as a master's degree in public health from the St. Louis University School of Public Health. Because of his overseas projects in China and Angola, he is fluent in Mandarin Chinese as well as Portuguese. He is also the author of 3 books. Let's listen as Jeff talks to Dr. Comninellis.
Nicholas, welcome to the Corporate Couch podcast this morning.
Wonderful to be with you, Jeff.
Yeah, we had some technical difficulties, so probably on my end, but love the Riverside platform, so there's a shout out to Riverside, but we did have some technical difficulties. But yeah, no, excited to talk to you. You're the first medical doctor to appear on the podcast, so that's exciting, and what you're doing for the medical profession with your Institute for International Medicine, and you have such an interesting journey. So yeah, excited to talk to you. You've been on many podcasts and you're a well-known speaker, but let's talk about a fun thing. When you were, what one thing would surprise people about you, even if they know you fairly well?
Probably that I'm a very private person, because I do a lot of speaking, and I love a polished video production, and I love an audience, but actually I'm the kind of person who recharges by being quiet and alone. So
Right.
that is a bit surprising.
Yeah. So you would describe yourself as an introvert, I would assume.
Yeah, because if you use that criteria of, well, what recharges you? Yes,
Right. Yeah.
it's that alone time.
It's so funny. I've interviewed many, great speakers and keynote speakers, and, almost all of them, I feel like are introverts. Like they're great speakers. But they, after a speech, they're like, I need my alone time.
Yeah, that's right.
Yeah. Yeah. No, that's great. So tell, where did you grow up, and what was fun for you growing up?
So I grew up in a small town just outside of Kansas City, called Parkville, and Parkville is best known for Park University, which is a small college. My father was born in Greece, and was a child during the German occupation,
Oh, wow.
and a quarter of the people in Greece starved to death during the occupation. And following World War II, well, the fighting in Greece continued. There were basically factions, civil war factions that continued battling for control of the country. And so my father was 18 or so, and he thought, maybe I'll go to the United States. Life in Greece right now is kind of difficult.
Right.
And he surveyed universities and he got accepted to this tiny little college in Parkville, Missouri, which is
Right.
where the story began.
Wow, very interesting. Yeah, I actually my first teaching adjunct professorship, I guess, was at Park College when it was the college, now Park University.
Yeah.
Yeah, that's great. What did you love doing in Parkville growing up? What was fun for you?
Well, it was a great little town to be a child. Man, there was woods and there was, I don't know, maybe 100 houses in the whole town. And we on Halloween, we would go to every single house in the entire town.
Right.
So yeah,
Yeah.
that was really precious. But in the summertime, my father would put us on the plane and we would go home to Greece.
Oh, nice.
And so I spent a couple of summers living with my grandmother on a little island in the Aegean Sea, about 5 miles wide. And so early on, I came to respect and enjoy other cultures and other languages and other ways of viewing the world, which was really formative when I started thinking about what I was going to do with my life later on. And so when I was going through medical school at UMKC, University of Missouri in Kansas City, close by, I was really, really interested in the humanitarian element of healthcare. I read a book titled Deliver Us from Evil, which was written by Tom Dooley. He was the U.S. Navy physician in charge of refugee care at the outset of the Vietnam War. And his account described hundreds of people arriving every day from the fighting who were hungry and who were cold and who were sick and who could not find their children. And Dooley and his little team of Navy corpsmen were providing food and medical care and housing and child location services with very little resources. I mean, they had no money, they had no equipment, they had no that it was raining all the time and there were epidemics going on, but they really did their very best to provide this care for them. And I thought
Right.
that is what I want to do with my life.
Yeah. So interesting. So, but going back to like childhood, like, did you have aspirations? Like when you're 10 years old, I'm going to be a doctor. Like what was the kind of that progression as a child all the way up to making that decision at some
Yeah.
point in your early teens or early 20s to be a doctor?
Well, like some of your audience, I grew up during the space age. And so, I wanted to design spacecraft and airplanes and fly to the moon. And so I was really set on aeronautical engineering
Okay.
as my track. But I was not very good at math. And I
Uh-oh.
applied to engineering schools and I didn't get in to the ones I wanted. And it was actually my father who sat down with me one day and he spread out on the kitchen table a big article about the new medical school in Kansas City. And he said, "Well, why don't you do that?" And I had never thought about really medicine at all. I was going to this engineering thing. Thank goodness my father stepped into the gap and gave me a different idea. And so I began to shadow a family doctor friend at North Kansas City Hospital, big institution here in Kansas City. And while I was still in high school, and I thought, yeah, now that I've kind of observed this field firsthand, I think this would be a good fit. Given both the science element of it and also the social humanitarian element of it.
Anyone that grew up, in the 60s, 70s, especially the early 70s. I mean, it was such a, space, and the astronauts were heroes. They landed on the moon and they came back to, ticker tape parades, and the early astronauts, starting from Chuck Yeager to John Glenn, and the whole Kennedy, we're going to land a man on the moon before the decade's out. I mean, it was just a kind of a romantic period of innovation and exploration, right? It was just like most kids wanted to be an astronaut or be something having to do with
Mhm.
space. But yeah, so interesting. Yeah, so It looked like you took a little different path though. During your residencies, or at least the first one. So talk about graduating med school and going into your first residency. It looked like you were in China.
Yeah, one of the elements that that really motivated me, in addition to the Greece, upbringing and the interest in science, was I had some friends in high school who had a friend who opened up the New Testament for me one time and read a passage of scripture from the book of Matthew, chapter 25. And Christ is talking, and he says, "I was hungry, and you gave me something to eat. I was thirsty, and you gave me something to drink. I was naked, and you clothed me. I was homeless, and you housed me. I was in prison, and you visited me." And the people listening, they said, "Well, heck, when did we ever see you like that?" And Christ replies, "Well, when you did this for the least of these." And I thought, that is such a model of compassion in action. And that particular account, parable of Christ, what was another really powerful factor. And so as I was finishing up my formal education, then I was looking for opportunity to put all these principles in practice. Well, the medical school in Kansas City at that time had a very strong relationship with the charity hospital in Shanghai, China. This was a result of Nixon going to China in 72 and then
Right.
being followed by people from the academic world who followed that pathway that he had opened up. And China in the 80s was a very poor country. Most doctors in Shanghai were living on $20 a month.
Right.
And no surprise, there was tuberculosis and rheumatic fever and schistosomiasis and diseases that we haven't heard of because they are closely connected with poverty, and poverty was much of China at that time. And so the opportunity to work at that charity hospital, was a great fit for my particular skills and interests.
Yeah.
And I'm just really grateful for those pioneers, who made possible that
Yeah.
open door.
So what, I mean, you're in little Parkville, Missouri, go to UMKC, which is in Metro Kansas City, Missouri area. But like, what was the biggest, like eye-opening thing when you went to Shanghai? Like, whoa, what surprised you the most?
Well, obviously, language is a challenge. I had studied Mandarin. I had a Chinese roommate. I had really done my very best to be prepared for that. But one of the things that was the biggest challenge is that in southern China, every city or every province pretty much has its own language. Now, northern China is pretty much ubiquitous Shanghai language or Putonghua. So communicating is pretty easy, but you get into southern China and it's much more local languages. And so the Shanghai language was not the one I had studied.
Right.
So people would talk to me in Beijing language, standard language, but then they would talk to others in the local dialect. And so I was always the outsider, didn't know what
Right.
was going
They were
on
talking
because,
about you,
uh,
Nicholas.
yeah, I'm sure they were. I'm sure they were. And so when people today ask me about, how do I prepare for working in a different culture or a different situation, usually my first question is, what's the language, and how are you going to approach language barrier?
Yeah. Interesting. So you look like you spent about 2 years in Shanghai, then went to Dallas to finish up your residency. Is that kind of the path at that point?
That's right. Yeah, I went to the public hospital in Fort Worth, had a great time there. And then I went to St. Louis University and did a public health degree. And about this time, my mom said to me, "Honey, you've been sharpening your sword and sharpening your sword and sharpening your sword. And when are you actually going to go do something?"
Yeah,
You
yeah.
know,
What was your strategy, Nicholas, behind getting a master's in public health?
the most important elements in health are not diagnosing disease. It's how do we prevent disease? What are those elements in personal behavior and in government policy that influence the health status of communities? And it's things like jobs and housing and safe drinking water and controlling communicable diseases. That really has, when you look at the numbers, has far more impact than whether you individually could go see a doctor. Of course, medical school is really good at the latter. What is the doctor going to do to care for you? But those really big issues don't get addressed in standard medical education.
Right.
And so that was my reasoning for doing a public health degree, because I was really
Yeah.
interested. If the
Yeah.
question is, what is it that makes for a healthy population? Individual physicians usually don't ask that. They ask, what is necessary for this particular patient in front of me to be
Right.
healthy?
Right.
Which of course is important. I like that when I go to the
Yeah.
doctor.
Yeah.
But if you're looking at the entire city, which somebody needs to do, then you need to have people who are prepared to address those big questions.
Yeah. Interesting. So, having you know, a fair amount of experience with kind of non-traditional or more Eastern philosophy in terms of medicine, in terms of prevention, not curing. So traditional Chinese medicine with the pulse points and acupuncture and all that. So, did you get exposed to that, and how did that influence your future? Thinking on practicing medicine in the States.
Well, I was exposed to that, but in China, even today, they have two schools. There is the Western medicine school and there is the Eastern medicine school, and their Western medicine physicians are trained just like us, and their Eastern medicine physicians, focus on those alternative things, acupuncture and oxybustion and pressure points, and they really don't mix the two together much at all. They have quite a separation, just like we do in the United States.
Hmm.
So
Interesting.
so I observed those things, but it wasn't something that I or my Chinese colleagues were actually practicing.
And then it looked like you go to Africa, Angola, to be a doctor. Is that kind of next step for you after getting your master's?
So there was an appeal that was circulated in the United States for a physician to come to Angola, a nation in southern Africa, which was best known for its civil war. Angola had been fighting since 1961. It had been a Portuguese colony, and first they were fighting for independence from Portugal, and then they were fighting among one another in their own civil war. And as a result, the health system, as well as everything else, was demolished. There were basically no functioning schools. Money was worthless. All the hospitals were closed. And so, in that context, there was a group of churches in the middle of the country who said, "Can we find an American doctor who is willing to come here and help us with some just real basic medical care?" And I received that appeal, and it actually took me way back to the book Deliver Us from Evil, and it was Tom Dooley working in a war zone, and I thought, heck, now's my chance. I had a little bit of financial support and went to Lisbon, Portugal, and studied Portuguese, which was a delightful experience. Lisbon is a beautiful place to live, and
Right.
Portuguese is a fairly easy language on the spectrum of language learning. And the Angolan people, of course, were quite gracious and eager, and I intended to spend about a decade in Angola. It got cut short. That's another story. But most people that we cared for in Angola were suffering from what I call the three M's: measles, malaria, and malnutrition. We did have people who had stepped on landmines, and we did have gunshot wounds and injured soldiers, but most of those people, frankly, died before they made it to our facility. The three M's are due to the war. If it wasn't for the war, there would be measles vaccine to prevent that disease. If it wasn't for the war, there would be crops to prevent the malnutrition. If it wasn't for the war, there would be malaria treatment. And so I would tell people the most important health intervention for this country is stop the war.
What cut your time short there?
The military campaigns escalated. There was no communication. I was offered a radio, we'll give you a radio, and that way you can stay in communication with us. And it's like, you're crazy, an American with a radio in the middle of Angola. It's like spy, spy, spy. I'm not going to
Right.
be that guy.
Right.
Um, but Doctors Without Borders were there, and they had a radio. And so they called me one night, and it was a pilot, and he, a very encrypted language. He said, "Did you know that your city's about to be overrun by the other side in the military conflict?"
Are you drowning in boring corporate communications? Palacio and Partners is here to rescue you. We transform internal podcasts from snooze fest to must-listen content that actually connects your team and strengthens your culture. Imagine podcast episodes that make your employees laugh while staying informed. Our founder, Jeff Palacio, doesn't just create podcasts, he creates conversations that break through the noise. Whether you're a growing startup or a massive corporation, we turn your company's story into audio gold. Leadership becomes human. Remote teams feel connected. Your message cuts through the clutter. Palacio and Partners, where corporate communications gets a fun makeover. Let's make your podcast work harder than your email inbox ever could. Jeff is happy to share his insights on podcasting with you. You can contact him via LinkedIn or schedule a Zoom call via the link in the episode description.
But Doctors Without Borders were there, and they had a radio, and so they called me one night, and it was a pilot, and he, a very encrypted language. He said, "Did you know that your city's about to be overrun by the other side in the military conflict?" And no, and he said, "Yeah, well, I'm coming to get you tomorrow." And I said, "Okay, I'll be ready."
Right.
And and then a few days after that, the army and the bush came into the city, and was glad I was out of there.
Yeah. I mean, did you have other instances like that where you felt like somebody could take your life? I mean, you're close to death, or I mean, the average citizen, especially in the U.S., has no idea what you're going through. I've interviewed Robert Abe Abrams, a 5-star Army general, and and I asked him, like, what's it like, being on a battlefield? Like,
You know,
no one really knows what that's like. It's a very small percentage of our
yeah.
population. But talk about that.
Well, one of the things that my Angolan hosts said right at the front is they said, "You never open your door at night. At night is when the thieves are out. At night is when the militaries are battling. During the daytime, Angola was pretty peaceful, and people would walk about on the streets. But everybody was home at night because that's when the gunshots started and that's when the explosions started." And so my host said, "Never, never, 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 ever open the door at night." So one evening I was indoors, and it was late at night, and there was this bam, bam, bam of the door, and I go, what's this? And I look out there. Well, the front yard is filled with soldiers, and there's a guy with his gun, and he's banging it against the door of my house.
Oh, jeez.
And of course, I think to myself, never open the door at night, right? Never open the door at night. And I walk around the perimeter of the house, and the whole house is surrounded, and the guy is still out there pounding on the door. And I think to myself, they're going to come in. There's no way I can prevent this. And so I unlatch the door, and the door creaks open, and I'm expecting the room to fill with these young guys and their guns, but it didn't. And after a moment, there was this older gentleman in a uniform, and he comes to the door and he says, "May I come in?" And I'm like, "Of
Right.
course you can come in." And so he walks in my little sparse living room, and he says, "Can I have a seat?" Yeah, so, of course, have a seat. And he says, "My name is Job. I am the commander of these troops. And I want you to know that we've been watching you. You don't see us, but every time you leave, every time you go out, my soldiers have been protecting you." And he said, "We know the good that you're doing. We know the children you're caring for. We know the elderly people who broke their hip, and you're helping them. And that's why we're protecting you. We're watching you." And so he said, "Do not be afraid. Continue to go out and to serve our people." And he
Wow.
got up and he left.
Maybe they could have just knocked on the door versus banging on it with the butt end of the gun, the rifle.
No,
Wow.
that's right.
Yeah.
Well, of course, the takeaway was that, as we are engaged in doing difficult things for the sake of humanity, there will be moments of encouragement, and I'm really grateful, for that particular moment,
Yeah.
and that even though the things we might do to serve one another are unseen, they are seen. We may not see the result of it right now, but we continue to do good nonetheless.
Yeah, no, fantastic. I mean, yeah, I mean, that's just, yeah, the average person can't even imagine being in your situation. So, I mean, that's not only, from the humanitarian and what you're doing, but also your courage to do it is unbelievable. So now you get out of Angola, with, safely. What was your plan after that?
So I came back to Kansas City and I started teaching public health at the med school here where I had gone to school. And I was immediately approached by young health profession students, people studying nursing and pharmacy and dentistry and medicine. And they said, I want to do what you did. I want to do that. Help, help me get started. And so this was early 2000s, which is about the time the global health movement began. And so I created some opportunities for these students to go study medicine, study nursing in a developing country with somebody that I knew. You know, I'm gonna send you to Kenya for a month, and I'm gonna have you work with Dr. Jones, and he's gonna show you what it's like to use your skills, in that particular context. Because I want people to have a formative experience, for them to be able to take whatever virtues and skill they have developed and actually use it on location safely with a supervisor. And as I began sending students out for this, I discovered that they needed a little more preparation, and so I developed some basic coursework. These are cross-cultural skills that you need to know. These are some diseases you need to know. These are global health issues you need to be familiar with. And after a couple of years of that, there was such a movement that I got together a board of directors and I founded a nonprofit, the Institute for International Medicine, which has now been running for 22 years and is now a graduate school offering, among other things, a master's degree in international health. But it all began with those altruistic students who said, "I want to do that too."
Yeah, amazing. So what was kind of the big surprise for you in terms of starting this not-for-profit? Like you're the founder, president, you're the one of I don't know if you were the only professor, but you're a professor. So you're wearing all these different hats and
Yeah.
starting a not-for-profit. So talk about that journey and the big surprises or ahas.
Well, I had never done this before, probably like a lot of your listeners who have never started a business before. But what people told me was that you had a really good idea. The mission of the organization. Our mission is to equip healthcare professionals to serve the forgotten. And people would say, "That's a great mission." So at the very least, even though you're going to stumble, even though don't know what to do, you have a good objective in mind. And so that constant reminder by by students, by staff, by board members was really important, especially in those beginning years.
Right. You mentioned Doctors Without Borders, and I was somewhat familiar with that. Is this what's the big difference in what you're doing and Doctors Without Borders?
INMED is an educational institute. People come to us, they get their graduate diploma, they get their master's degree, and then they go on to work for organizations like Doctors Without Borders. So, Doctors Without Borders, they're front lines. They're on the ground in Afghanistan, they're on the ground at a disaster zone. What we do at INMED is we prepare people with the vision and skills they need to be able to do that kind of long-term work.
I see. I see. So you pivoted away from kind of sending these healthcare professionals out to these, underdeveloped countries that, didn't have, healthcare and, standard medicine that we take for granted here.
Well, they still do that as part of their education experience.
Okay.
And so if they come to study at INMED, they're going to do academic courses, but then they're also going to do what we call service learning, where
Okay.
we pair them up with a supervisor on the field,
Okay.
so that they actually get a chance to apply that skill in real time.
Yeah.
And
What
for
do you,
most of these young people, that's like the most powerful experience of their whole life. Somebody
yeah.
comes, they're 23, they just got back from 3 months in Kenya, taking care of disabled children. I mean, that's like the most powerful thing that may have ever happened to them.
Yeah. Um, Maybe outside of COVID, or you can include COVID, but Nicholas, what was the biggest change you saw over the 22, from 2003 to 2025? What have you seen, like kind of the biggest changes in need, or whatever, whatever observation you have on that?
The emphasis on global health has come and it's kind of gone. In the 2000s, this was something that people were talking about on university campuses and forming student organizations, and funding was high for this kind of work, global health work. Well, now that has somewhat dried up, both on the universities, on the government level. And so, in spite of that waxing and waning, which is a normal phenomenon, nothing's going to remain popular forever. The need of humanity around the globe has not changed at all, just because our interest level is not quite as high as it used to be. And so, I find that just the importance of staying the course, staying steady on mission. There are always going to
Right.
be people who are forgotten, and we're
Yeah.
going to continue to be there.
Yeah. So, like the COVID, for example, I mean, you heard about COVID, obviously, in Europe, and obviously the U.S., Canada, Mexico, but was it less, a pandemic? I'll say, I don't know, in Angola, or African countries, or I heard one of your speech, you called it the stands, the Russian, the ex-Russian provinces.
Well, it's hard to answer that because there wasn't as much epidemiologic surveillance. Nobody was out there testing lots of people to find out how
Right.
bad was it, and collecting statistics in those kind of low resource settings is really difficult. And so we can say that, yeah, it was happening in these countries, but we just don't have the vigorous statistics that we do, in North
Yeah.
America.
Right. We don't know if they implemented the 6 foot distancing and face masks.
Right. Yeah.
Yeah, interesting. Yeah. So, what's next for Institute for International Medicine? Like, where do you see the organization going in the next 5 years?
We have got a steady stream of healthcare professionals who do what we call our graduate diploma. That is a 15 credit hour experience that involves some coursework, and then most importantly, that field experience that I described. And so we have about 100 people a year who are doing that. But increasingly, we hear healthcare professionals saying, "I want more." And so our real emphasis is on the master's degree opportunity. So 3 years ago, we had 30 in the master's degree. Today, we have 60 in the master's degree. I think that's just going to continue to grow as people are wanting not only a higher credential, but also more expertise in that field. The other piece that is part of my particular work is establishing our relationships with service experiences in other countries. So, for example, we have someone we have. I had this morning. I talked with a Russian-speaking medical student who said, I really want an opportunity to use Russian when I do my INMED service experience. Well, we work together with a group of Russian doctors caring for refugees in Moscow. But of course, we're not sending anybody to Moscow right now. But
Right.
but there are other opportunities in Eastern Europe, and so developing that place where this particularly talented Russian-speaking young doctor can go is really exciting to me because you're motivated, you're gifted. Now let's find a place where you can use your skills.
What personally, leading this organization is your biggest challenge for you?
I think it's multitasking. I recruit students, I teach courses, I do board relations, I do fundraising, I do strategic planning. Typical for so we're small. We have $1 million budget. We have 8 full-time staff. We have 5 faculty, and everybody at InMed wears multiple hats because
Right.
we're doing our best to
Right.
keep keep this thing moving.
If there's one ask you would have of the listeners to help you, what would that be?
The first ask I would say is apply the principle. Is there someone in your little network, someone in your little world who could use a hand? Is it a next door neighbor? Is it a nonprofit you're familiar with? Do something within your own world to reach out to somebody who is suffering. I think that's the basic principle.
Right.
And then regarding us in particular, I would just invite people to come to our website and watch our 2-minute intro video.
Yeah.
Get to know what we do. INMED.us, INMED.us, and have just a little more picture of the kind of mission that we're working to accomplish.
Yeah, I mean, it's a phenomenal work. I'm grateful that Mark Schaefer introduced us, and it's phenomenal. Love that. I know you're a multi-time author, but you're love to hear about your new book that came out last month in July of 2025. 5 Bags of Gold: a modern parable of wealth, responsibility, and internal investment. Talk about that.
So 5 Bags of Gold is built on that scripture that I mentioned to you at the beginning of our conversation from Matthew chapter 25 about what are you going to do with your resources? And by resources, I mean not just money. I mean your time and your talent. And how are you going to direct those resources on behalf of these people who are hungry and thirsty and cold and naked and lonely? And the book is the application of that principle in the context of the INMED story. And so the book traces some of what I've told you, in the last half hour about how the organization began and our early steps, all the while applying that principle of care, compassion in action.
So you talked about all the things you're doing. Obviously, you're wearing so many hats, but I picked out something from either your bio or your LinkedIn, but you find time to be a classical guitarist. So talk a little bit about that, and how much joy does that bring you?
It sure does. Some of you are familiar with Albert Schweitzer. He was the great German musician he's the guy who translated all the Bach from orchestra to organ, and he was very famous in the 1950s and 60s. Both as a concert performer and then as a doctor in Africa. And throughout his later life working as a doctor in obscurity in the nation of Gabon, well, he was doing concerts for the locals on the organ.
Wow.
And I thought, that's really precious. I want to develop a skill like that. And so as an undergrad at UMKC at the University of Missouri in Kansas City, I took classical guitar at the conservatory
Wow.
and just continued to develop that since then. If you're ever a patient at Research Medical Center in Kansas City, come down there during noontime, and I might be the guy playing guitar in the cafeteria.
Oh, wow. That's so cool. So cool. I love helping 2 groups of people. One's that recent, either high school or college graduate, depending if they go to the college or university. But as they navigate their first professional job and begin their professional journey, what advice do you have for that group of people?
I found that asking people who know you well for direction is really, really helpful. A young person has got so many different avenues that they could pursue in terms of their education and their career, and asking people who know you well, what do you think is a fit for me? And so you ask your coach, you ask your teachers, you ask your parents, you ask adults who have a little more life experience. That was really critical for me. These people that you're asking, they may not know anything about your particular professional vision, but they know you and they know
Right.
what are your interests and strengths, and so take advantage of that wisdom they could offer.
Yeah. No, I love that. I think I've asked over 140 people that question on the podcast, and I'm thinking that might be the first advice that no one else has given. So yeah, I think that's phenomenal. So thank you for that. The other group I love helping is, while everybody can be a leader, but those that take the leadership path of actually leading a group of people on an org chart or at an organization, and now they're responsible for that team officially, and they take that first time role, what advice do you have for them as they begin that journey?
Focus on the vision of the organization. If you as the leader are not constantly reminding people of why are we doing this, nobody else is going to do that.
Yeah.
And so, of course, part of your role is going to be dividing up responsibilities and delegation. And yes, you got to do that. But nobody is going to cast the vision like you are. And so being the embodiment of the vision of the organization is the most critical thing you can probably give to that group.
Yeah, I agree. All people want to be part of something bigger than themselves. And I think that setting that vision is such an important role for a leader. So thank you for that advice. Nicholas, you've been great to have on the podcast. Like I said earlier, I'm so glad Mark Schaefer introduced us. So thank you for coming on the Corporate Couch today.
Wonderful to be with you and your audience, Jeff.
Wow, Nicholas, what a story, career so far. I mean, talk about going from a small town in Missouri, Parkville, Missouri, where he could hit all 100 houses on Halloween, to war zones in Africa, to founding a graduate school, and having this mission and throughout his life to serve the forgotten. I mean, medical expertise, his courage, being a humanitarian. I mean, what about the story where he's in Angola and they're banging
on the door?
They're banging on it with the butt of the gun, the butt end of the gun. And he's probably thinking, holy shit, what the hell have I gotten myself into? And then he goes to the door finally. They go, may I come in? And they just tell him, hey, we're here. Just want you to know we've been here protecting you. And I said something like, couldn't they just knock versus banging the butt end of the gun?
That was a great story. Great. And that proves that you don't always know who is protecting you, or if any.
Right. Yeah, exactly. We all have our guardian angels, but yeah. And finally, Joe, I ask, almost every guest, what childhood aspirations, and you have to be of a certain age bracket to have this one. But he's, I believe, the first one that said he wanted to be an astronaut, which, many children growing up in the 60s and 70s and possibly the 80s might have had that.
We all
dream,
wanted
but
to be
he's the first one to
astronauts for a
admit it.
while. We all wanted to be astronauts.
Yeah.
It was great.
Yeah. And I wasn't familiar with Tom Dooley, but he was a Navy doctor that cared for Vietnamese refugees and had basically no resources and the shitty conditions. And I guess wrote a book about it called Deliver Us from Evil. And Nicholas read it, and it inspired him really to do what he does, and having a graduate school to teach doctors how to, go to these underdeveloped countries that are suffering. I think he called it the 3 M's in, Angola, just, measles, malaria, and malnutrition, but just things that we take for granted that we don't have here. And just a phenomenal story, and just, and he's not stopping anytime soon.
That's right. You could just go on and on and on with him. It's interesting that he talked about going overseas and serving. To do what he's talking about, you already have to kind of be a doctor or have some sort of medical training or something like that. And what I want to make sure of is that our audience realizes that you don't always have to be a doctor to do something to go overseas. The stories that I'm most familiar with, just because the people that I hang around are musicians. And so there are a lot of musician organizations that are very similar to this, that they will take a group of musicians like me and take them overseas and have them do music stuff, just like Dr. Nicholas is doing healthcare stuff, helping people to lead a better life through music and giving concerts and things like that. And I'm familiar with several different organizations that do things similar to that, and have gone to places like Uruguay and Brazil and Angola and Nigeria and Belarus, being musicians and ambassadors for music in the world. And I think that's great. One of the things that they'll do, for instance, is they will take music supplies overseas with them. They can carry them in their briefcase, in their suitcase in their luggage, and they would take clarinet reeds and saxophone reeds and valve oil and things like that, stuff them all in their luggage, and then when they take them overseas, just conveniently leave them behind because it's so hard for people over there to get musical supplies. But it's not just musicians and healthcare workers. Anything has organizations that will take you overseas and help you do things, that drill oil wells, build houses, build churches, organize things, teach English, all sorts of stuff like that. I would encourage anybody to look into that kind of stuff, do some Google searches and find some organizations that manage those kind of things.
Yeah. And the other thing that came to light, which we've seen many times, is, these great keynote speakers and public speakers are introverts.
Oh, yeah. That's something.
Yeah. Nicholas said, I'm a private person. I have to, recharge alone. But great speaker. So I just thought, it's a reoccurring thing. And it seems, I haven't done a quantitative analysis on it, but it seems like most of the great speakers are introverts. But I just thought that was...
We noticed this a couple of weeks ago where we were talking about that a lot of them are dyslexic also.
Yeah.
So introvert dyslexics unite or untie.
Yeah, there you go. Joe, what's going on with you this fine
I've done some research and I found out something about egg whites lately. Yeah, really? I discovered that you should never use sarcasm around egg whites because they can't take a yolk.
Thank you so much for listening to this episode of The Corporate Couch. If you enjoy the podcast, I would love for you to take 2 minutes out of your day to rate us 5 stars and write a review. Please join me next week to learn from another great leader sharing their professional journey and insights.